for the cervical spine. I'm just going to cover some, like, a common finding you see on these, and not just post-accident, but if you run your own office, you'll see similar things. And I just want everyone to keep in mind that when you get, the important thing to keep in mind when you get reports and you take imaging is that it's a moment in time, right? So anything you see on there may not be how things always are. There's going to be structural stuff, bony changes, disc-related issues that were there, but some of the things about how the posture of the person is may just be an artifact of the situation or the day. And something we send out a lot of people are in accidents. We're doing a lot of neck imaging for whiplash potential documentations. And when you look at the cervical spine, a lot of times with the reports back from the radiologist, this is something that you're going to see a lot of. And I'll quote straight off the report: straightening of the cervical lordotic curvature, which, and this is the important part, which can be related to muscle spasms secondary to trauma. So we have to always keep that in mind when you're working with a person, to not make such a big deal out of some changes in the lordotic curvature in the moment, so that instead of that nice C-shape position of the spine, that is kind of the textbook thing that you see, and there's a lot of variation there as well, and people get way too hung up on what it means when people are outside of certain parameters of curve. But when we do see folks that are in acute neck pain, or even if it's not accident related, if there's at your clinic with acute neck pain, there's a chance that just because they're tight and under some tension, especially if they're after an accident, they're gonna have had some high velocity related trauma to those muscles of the neck and the joints and other structures of the cervical spine, and there's going to be some spasming and tightening of those muscles, which may be why we're seeing a loss of that anatomical lordotic curve of the cervical spine that chiropractors obsess, and others, but chiropractors mostly obsess about restoring in people. And it might not even, for one, it might not be that big a deal at all, but two, it may just be related, what you're seeing that day from the x-ray they took at that time post-accident may just be related to the that tightening and spasming that's going on and is leaving the person in that shape. And as they loosen up, and so, like, even if I did nothing to them, if 3 weeks go by and we see a reduction in tightness and spasm of the muscles of the cervical spine, and we took another x-ray, we may see kind of that normal positioning even without treatment. So you always have to take a lot of that stuff with a grain of salt. I don't even really discuss that finding with a patient because it doesn't mean much, and I just hope you guys, just trying to give you guys that insight into remembering, a finding like that on an x-ray post-accident doesn't really mean much. It's not going to change your approach to care, and the person will probably get better and get back to restoring what they may have had before the accident as their body loosens up and recovers from the trauma. So hope that's helpful, and see you guys later.